I had somebody come up to me like, "You're about to declare war." I'm like, "Yep." Well, it was like $8,000 for a 15-minute procedure, and I just got a note from my health insurance plan that said it was medically unnecessary. So I called the insurance company. I was like, "I quit. If you're not going to pay my bills, I'm not paying your bills." You know, United Healthcare, they have $500 billion in revenue because they actually make more money when we're sick. You work for whoever pays you, and guess what? The doctor is getting paid by an insurance company. And so that's who they have to report to, not me, the end user. You're not the consumer of the healthcare system. You're the product of the healthcare system.
Big pharma, insurance companies, big food, everybody's working with each other and trying to kind of rig the system.
I don't even know if it goes to the extent of conspiracy theory because we've seen it play out over 50 years. I want our members to be 80 years old, playing wiffle ball in the backyard with their grandkids.
Welcome to the very first episode of the Off-Label Podcast. I am Dr. Clay Moss, and I am a medical resident going into the world of functional, preventative, and performance-based medicine. Why? Because I've seen firsthand how broken the traditional healthcare system is, how it pushes pills over root causes, profits over people, and leaves patients sick, confused, exhausted, and not knowing where to go next. This show is called Off-Label for a reason. In medicine, off-label means something for a purpose that it wasn't originally intended for. This podcast is about doing just that. Stepping off the beaten path, talking to people outside the traditional medical system, entrepreneurs, health renegades, scientists, coaches, maybe even pastors. Because your doctor doesn't always have the answer. Sometimes the best insights come from where you'd least expect them. So, in today's episode, I'm talking to Andy Schoonover, the founder and CEO of CrowdHealth. It's not an insurance company. It's a completely different model, one that lets you pay for your health care without feeding the bloated, corrupted system. This conversation is about courage, clarity, and taking control of your health and your money. If you've ever felt trapped by your insurance premiums, or you're scared that you're going to get hit by a massive bill 6 months after whatever service you had to get, this episode's for you. Enjoy. All right, so we're live. All right, Andy, so stoked to have you here, man. Thank you for joining us on the Off-Label Podcast. And I've been digging into your story. I've got to say that what you've built with CrowdHealth has been bold, to say the least. Is that something that is striking to you too?
Yeah, you know, when I first started the company, I had somebody come up to me. He was like, "You're about to declare war. Do you understand that?" I'm like, "Yep, I get it. I get it." There's a lot of entrenched players that have lots more money than I do, who would love to see us fail. So I'm very well aware that this is somewhat bold, but I also think that, you know, the way that our current system is built right now, somebody has to do something bold. You know, I put a tweet up the other day that was like, you know, the healthcare system is kind of like a 1970s ranch that has a load-bearing wall in the middle of the living room. Like, you just can't renovate it. There's right. No incremental changes that you can make them. You gotta tear it down and you gotta start again. And so that's ultimately the approach that we're taking with CrowdHealth, is just tear it down and start all over. That's the way it needs to be, I think.
Right. No, I mean, I couldn't agree more. And before we get into exactly what CrowdHealth is, I just want to take a step backwards and rewind. So you weren't always in this world, I'm assuming. So kind of take me back to that moment where it clicked for you when you realized, oh crap, like the system's broken and somebody has to step in there at some point and try to fix it.
Yeah, this is actually my second healthcare company. I sold the first one to a private equity firm, and I told myself, I was like, I'm never going to do this again. Like, healthcare is so unbelievably difficult to operate within, especially if you're trying to do something entrepreneurial or disruptive. And you know, but I think the universe had a different story for me. I came off that. I sold the company, and as such, I didn't have health insurance because most of us get health insurance through our employer. And so I went to the Affordable Care Act, the healthcare.gov platform, the marketplace, and because I thought it was my only other option. And so I got a plan for me, my wife, and my two girls. And I think it was $1,100 or $1,200 a month, something like that. And I kind of joke it worked until I had to use it. My little one was having recurring ear infections. And so we went to the pediatrician, who's told us she has a hole in her eardrum. We went to the ear, nose, and throat doctor, who's like, yeah, she needs to get tubes in her ears. So in essence, the fluid was building up in her ears because she was having recurring ear infections, and it popped her eardrum. And so they have to stick a little tube in there to let all that fluid come out, so that she wouldn't have recurring, ear infections. And she was screaming, all night long in pain. So we went and got it done. It was a 15-minute procedure. I think it was like 3 or 4 weeks later, we got the bill, and it was like $8,000 for a 15-minute procedure. And I was just like, holy crap, like, this is ridiculous. But this is the whole point of health insurance. Like, health insurance will pay for it, right? Unfortunately, a few weeks after that, I got a note from my health insurance plan that said it was medically unnecessary, and so they weren't going to pay the bill. And I went through multiple rounds of appeals, and at the end of the day, they're like, "Nope, we're not going to pay it." And I'm just like, "What the hell?" So I called the insurance company. I was like, "I quit. If you're not going to pay my bills, I'm not paying your bills." And I then went to my wife, and I was like, "Guess what? We're uninsured." And she kind of looked at me with this weird face, like, "What are we going to do now?" And over the next, it was 12 or 18 months, I was trying to figure out, like, is there a way to operate without having health insurance viably? Um, and I found out that I could negotiate these bills down. I didn't know that I could negotiate that $8,000 bill down to probably $2,000 or something like that. I didn't realize that if you went and paid in cash or paid them directly, doctors or hospitals, they would give you a much better price. And so ultimately, I kind of got to this point of being like, man, I think we can do this. And I bet you other people are as pissed off about health insurance as I am. So, if we can get a group of people together who are willing to help each other with healthcare expenses, I think there's something to this. So, it's as they say, out of misery comes mission. And ultimately has become my mission to change the way that we pay for healthcare. And so far, so good.
Yeah, it's funny because, you talk about your story with your daughter, and even me being in the healthcare world. I'm a physician. I went through medical school. I'm currently completing my medical residency. And at the time that I was going through med school, COVID happened. And so it was kind of like a fast track to realizing all of the ugly truths of the healthcare industry. It was kind of like the veil being lifted for a lot of people, including myself, which is kind of why I wanted to go more into like the functional medicine preventative style of medicine, where we're spending a little bit more than 10 minutes per patient and things like that. But even on my end, a couple of years ago, I was doing my away rotations at all of these residency programs, and I was actually down here in Tampa visiting, and I had periorbital cellulitis. So I had this awful infection in my eye, and it was so painful to the point where, to me, it seemed like a medical disaster. So I went to the ER. I went to some HCA ER down here. They didn't even use an ophthalmoscope to look in, or they didn't even use anything to really look in my eye other than a phone flashlight. They looked in my eye, they gave me a prescription of antibiotics, and they sent me on their way. So nobody actually laid their hands on me or used any sort of tool. And all was well and good until 8 months later, I got hit with like a $4,000 bill for all of these things that they did when they really didn't do anything. And so it was a very similar experience to me, and it was just wild because I was already in the medical profession at that point, and I was like, man, I totally see why patients have this perspective of everything over here.
Yeah, absolutely. I mean, I think that's what you're seeing is people think that they're going to go into the ER, and you were probably there. I don't know how long you waited, but in terms of like actually getting seen, you're what 15 or 30 minutes or something like that, and they go and charge you. They're charging you $4,000 for that. I mean, it's absolutely ludicrous. And again, once I found out that you could actually negotiate those things down, then I'm like, that's when the light bulb popped. I'm like, wow. And what I really found out, which is blows my mind, is United Healthcare, they have 500 billion in revenue. About 1 out of every 10 of our healthcare dollars, 10% of our healthcare dollars goes through United Healthcare. You would think I'm an MBA guy. Don't hold it against me, but like I would have thought that this company with this massive size would be able to use its economic might to drive these prices down. But what I found out though is that the incentives for these big health insurance plans is not to drive down prices. It's to allow prices to continue to increase over time because they actually make more money when we're sick as opposed to when we're healthy.
Yeah.
And that's the real scandal of all of this is they're actually not incentivized to get us to healthy because they're making more money when we're sick. So, is that at that point where I was just like, man, something's got to be done. I mean, it's absolutely ridiculous, the perverse incentives within healthcare.
Yeah, let's break that down a little bit because we talk a lot in kind of the functional medicine space about, the traditional space has a tendency to prescribe certain medications or do certain things to put band-aids on symptoms, whether knowingly or most of the time, like we kind of hinted on earlier, doctors are getting reimbursed less and less and having to see more and more patients in the same amount of time. And so I know you've touched on this in the past, that a 10-minute doctor's appointment, it's very hard to actually get to the root of the problem. And you want your patient to leave with something. And that one thing, more times than not, ends up being another prescription.
Exactly. I mean, given you all are getting hammered on your rates for some of these services, there's nothing else the doctor can do, especially in primary care, where if they have 10 minutes with you, there's no time to talk to you about what you're eating, your exercise routine, your sleep habits, all the things that are really important ultimately to your health. And so they just are trying to fix the issue as opposed to getting to the root cause. And like you said, ultimately and unfortunately, most of the time that's just a pharma, which you're sticking, chemicals in your body that don't necessarily need to be in your body, of course. And you can solve it with a lot of lifestyle issues. And so, it's this almost like death spiral. I learned how to fly about a decade ago, and they called this the death spiral. Like once you get into this spiral, like there's just no turning back. And that's why it says, hey, there's no renovation here that we can do to healthcare. Like we really have to like rip it down and start back up again because of all these perverse incentives.
So I want to ask you this question too, because you know a lot more about this stuff than I do. The amount of education that we get about health insurance in medical school is very minimal, even though it's a huge part of our lives. And you could make the argument that health insurance companies are almost making more medical decisions than physicians just because of the way that the system works. So I'm curious, how are reimbursement rates going down, yet patients are paying more and more as the years go on, and we're I think the top healthcare spender in the world by over double.
Yeah, because I think it really depends upon where you fall in the healthcare system. The rates that you're seeing dropping are typically in the primary care space. Everything else is going up. And so let me get back to kind of the root economics of this, because I think it'll make sense to people. And people generally are like, man, I don't understand healthcare. It's so complex. And, my response is it's not that difficult. Like you have these big hospital systems. And by the way, they're consolidating. So these big private equity firms are going in and buying these hospital systems and buying more and buying more. And so instead of 4 different systems in your town, you have 2 systems in your town, right? Which gives them leverage over these health insurance plans. And so, these hospital systems, they want the price to go up. I mean, I get that. I understand that. Like it's a capitalistic system. You're the provider of a service. You want that price to go up. So the seller of the service wants the price to go up. But what people don't understand is the buyer of the service, which is these health insurance plans, they also want the price to go up. So if we're using really simple math, if I'm paying $1,000 of premiums to my health insurance plan, they can only make $150 of that premium in for their administrative costs and their profit. And so, how do they get that 150 and grow it 10% to 165? Well, guess what? Your premium has to go from $1,000 to $1,100. So in essence, the buyer of healthcare actually wants your premiums to go up over time. They want the healthcare cost to go up over time because they make more money. So you have the buyer of healthcare, the health insurance plans, and the seller of healthcare, which are these big hospital systems, both wanting the price to go up. And so I kind of joke, it doesn't take a PhD in economics to understand if the buyer and the seller of something want the price to go up, the price is going up. And so those are the perverse incentives that I've been talking about in our healthcare system that keep driving prices up. There's no counter force to keep these prices down other than in the primary care space, or the hospitals, the primary care docs, they have no power whatsoever in negotiating their rates. If United Healthcare comes to you and says, and they're 50% of your business, and they say, hey, I'm going to drop your price this month, then what are you going to do? Like you're gonna be like, okay, I just have to take it, and then they can go to the newspapers and say, look, we're driving down prices, but it's with the primary care doctors primarily. All the other docs, generally, not all, but generally, everybody else's rates are going up.
Yeah, I've actually seen that in some of the more lucrative parts of medicine too. Like you see it in the pain medicine, or at least the interventional pain medicine space. So, for instance, I have a bunch of colleagues who are in that field, and they are so accustomed to doing like radio frequency ablations and spinal nerve blocks and things like that. That's kind of a means to try to give a patient some relief that way, instead of keeping people on opioids or putting people on opioids or stronger pain medications or things like that. And even in that space, which was previously a pretty lucrative field, is now being cut reimbursement to the point where residents aren't even going into pain medicine anymore because,
Hmm.
what's another year going to do if you're going to make less money than you would be if you just did something else?
I think all the controversy around pain medicine over the last decade probably hasn't helped either.
No,
In
not at
terms of
all.
like keeping opioids out of people and things like that. So it's like I said, it's just filled with perverse incentives from companies who are looking for the profit, and it's profit above care.
Right.
So I call it, it's, or many people call it sick care instead of healthcare, right? Because that's
100%.
and ultimately what we're trying to do here. So, or what they're trying to do to make more money off of those situations.
Right. I mean, I've heard Brigham Bueller talk about it before too, about how there's
Yeah,
nothing more profitable than a sick kid that's going to stay alive. The whole point is not to let you die, it's to keep you sick as long as possible because that's the most amount of dollars coming in.
isn't it a tragedy?
It is definitely a tragedy. I do want to talk to you too. The Affordable Care Act or Obamacare, what exactly? I'll give you a little bit of background. My fiance, her parents were actually they owned a health insurance company, a smaller company in California before Obama took office and then the Affordable Care Act took place. And they talk a lot about how the whole system kind of changed when that happened, and they felt so much worse about what they were doing, and they ended up just selling it and dropping it and moving out of the space because the whole industry kind of got a lot dirtier whenever that was passed. And I'm trying to wrap my head around what exactly happened when it got passed and why that's the case.
Yeah, I mean, I think it's a complex question. The medical loss ratio, that 85% that I
Mm-hmm.
mentioned earlier, was established under Obamacare. And so this was what, 15 years ago now, I guess,
Yeah.
ish, when it started. And so that's when I really think we saw this kind of transition from caring for people as opposed to caring for profit, right? So
Yeah.
in a normal economic environment, if I get $1,000, what would I want to do? Is I want to drive down my costs. In this case, is the healthcare services as much as possible, so I can extract as much profit out of that as possible. That's just basic economics. But in reality, what this did is it made it a cost plus system
Mm.
where you're basically getting for your services, you're getting an extra, for easy math, of 15% on top of that. It's
Right.
it's similar to what's going on in the military industrial complex. The
Right.
military has a cost plus system, and so what does it do to Northrop and Boeing and all these companies? They want
Right.
to see costs go up. They want to see delays. They want to see all these things. So the ultimate cost is really big. So their 10% or 15% or whatever they're taking is as big as possible.
Mm.
And so I think that's the underlying issue in which we have, where if you know the legislative branch of our country can't get anything right, it doesn't feel like. So if they wanted to do something right, they would get rid of these medical loss ratios. But if you think about it, like, why did they do this 15 years ago?
Right.
Because it makes sense for people who don't understand basic economics to say, oh, we don't want insurance companies to screw us. We don't
Mm.
want our insurance companies to profit us. And so let's limit the amount of profit they can take. But in essence, what that did is that incentivized them to see costs go up as opposed to costs going down. And so I think, Obamacare kind of put that into motion. And now here we're seeing it, 15 years later, where if you're looking at the costs of healthcare over the last 15 years since Obamacare has got started, it's actually ticked up.
Mm.
So, yeah, if you look at the graph, it's kind of like, and so it's just a wild thing where it was supposed to be the Affordable Care Act. It's actually made healthcare significantly more expensive than it was beforehand.
And the weird part is that it's gotten so much more expensive, and it's funny how you can wrap things up in a bow and make it look like whatever you want it to look like, especially in the political space. Like for instance, with some of these procedures, I know Medicare, Medicaid was cutting the reimbursement rate to a lot of these procedures and wrapping it up in a bow, saying, "Oh no, we're doing that so that doctors do more conservative treatment before doing surgery." And the outcome of that was, well, doctors are actually just going to pile on more surgery so that they can
Exactly.
make what they were before. And
100%.
so, you know,
Oh, well, really quick, the other thing here is they piled a lot more stuff into insurance.
Hmm.
And so before it was, hey, a bunch of this stuff had to be out of pocket.
Right.
So for example, I know this is maybe one that a lot of people don't want to talk about, but it's birth control. So
Right.
birth control before Obamacare, you had to pay for it out of pocket.
Hmm.
Obamacare then required all these health insurance plans to pay for birth control. And there's this crazy graph out there that for like 10 years, birth control is like this, flat, the cost of birth control. And all of a sudden, Obamacare made it required. And then it just went like this, like it went straight up. And so in essence, what happens is if you're not paying for it, you don't understand the value. There's no value for value transaction there. You don't care what it costs. Like, give me the Ferrari of birth controls. I don't have to pay for it. Somebody else is paying for it. Whereas if I'm paying for things with my own money, then I'm really paying attention actually to what, I'm consuming, I'm putting in my body. Right. If you go to the car dealership and you don't have to pay for it, I don't know about you, but I'm buying the Ferrari, right? As opposed to my, used Tahoe. And so it's just those basic economics are lost within healthcare. And I think ultimately that's what's led to these incredible rising costs. As you said, it's 2x what the other countries are paying. Similar kind of demographic countries are paying. There's one other thing that has impacted this, and this is not a 15-year phenomenon, but this is a more 50-year phenomenon, where we have the most obese country by far. I think we are 40% more obese per capita than the other OECD countries, which are 35 countries throughout the world that they keep all these stats on. So, when you're obese, as you know, as a doctor, significantly more healthcare is going to be consumed by somebody who's obese than not. Yeah. I think it's 10 years difference in life expectancy of somebody who's obese and not. Everybody's looking at these life expectancies and saying, I can't believe America with the best healthcare in the world, the best doctors in the world, which I think we do have, actually has a lower life expectancy than some of these other crazy countries, out there that you would not assume would have really good healthcare. Why? It's because we're so obese that if you adjusted for obesity, we would actually be ranked in the top 5 countries for life expectancy. Wow. So this obesity, which is leading to things like diabetes, which 25 cents of every dollar that we spend in this country on healthcare goes to people with diabetes. It leads to all these other, cardiovascular issues and things like that. I mean, it's just, again, we're in this death spiral of healthcare costs. It's going to be very difficult to come out of unless we have some significant behavior change. I dropped a lot on there for you. I'm sorry about that.
No,
you got me ranting.
I couldn't agree more with you, and I'm glad you did. I'm curious, I love a good conspiracy theory every now and then, and it just seems like more and more of those are just becoming true as we start to just go about life, especially after COVID. What do you think? We talk about the obesity epidemic. We talk about how we're becoming, worse and worse off health-wise, how health prices are rising. Health insurance companies aren't really looking out for us. What is that dynamic between big pharma, insurance companies, big food, and politicians? Like, I know we can speculate that everybody's working with each other and trying to kind of rig the system. Is that true? Like, can we really point to certain things saying that this is all kind of a calculated effort?
I mean, it's a conspiracy theory for sure. I mean,
Definitely.
Again, it kind of goes back to the 70s, right? When Nixon saw inflation going rampant, gives all these subsidies for all the crap that we're now putting in our bodies.
Right.
Not too late after that, you have this food pyramid, which has all this crap as your basic, foundational, fundamental kind of component of your health, which then led to people becoming fatter and fatter and fatter, which led people to becoming, having more diabetes. I mean, the crazy stat is that 1972, I believe it was, 1% of the population had diabetes. And type 2 diabetes was like a total rarity. And now it's over 10%. The last number I saw was 10.7% of our population has diabetes. And I think it's 92 or 93% of those with diabetes have type 2 diabetes, which is a lifestyle issue as a result of, all of this crap getting put into our bodies. And so there's for sure a profit circle that goes on here. The more crap we put into our bodies, the sicker you'll become. The sicker you become, the more healthcare that you'll consume. The more healthcare you consume, the more profitable all these big healthcare companies become. And so it's just this, vicious circle that we have. And by the way, the legislators are in this too.
Right.
They're the ones that are funding a lot of this stuff. And so,
Yeah.
I don't even know if it goes to the extent of conspiracy theory, because we've seen it play out over 50 years. Typically these conspiracy theories, you can figure out a decade or two whether they're real. This one I think is pretty core to who we are as Americans. This reliance upon crap that we put into our bodies. So fortunately, we're starting to see some of that being reversed, and some of this, the dyes and stuff that we're putting in our food. We're seeing more and more, companies pull that out, and so I think we need a jolt to the system to get this, to get this somewhat recovered.
Yeah, I 100% agree about that part for sure. I think that it's not one of those things where you can kind of ease your way back into normalcy. You have to kind of wipe the slate a little bit, and maybe there'll be a kickback or a knee-jerk reaction at first, but we have to get on track at some point. Like, we're obviously haven't been heading towards a positive outcome for a number of years now. And my question to you, we talk about profits, and I feel like a lot of the time when we talk about profits, we think of corporate greed, right? So where is there an intersection between corporate greed and government policy? Because I think a lot of people can get mixed up with thinking that the healthcare model is flawed because of corporate greed instead of government policies, when it might be the other way around.
Yeah, I mean, I think it's totally the other way around. I mean, ultimately, what I think we've seen, like, let's remove healthcare from the equation, for a minute. Anytime you have a corporation that is fundamentally seeking profits, then that profit seeking will lead to competition, which ultimately will lead to lower prices. And what you'll see is anything that the government touches will actually rise in price, because it just eliminates competition through regulatory capture, legislative actions, things like that. There's another interesting Git graph that's been floated around. I think it takes a look at like the last maybe 25 or 30 years in terms of all the things that we consume as just human beings, and it looks at TVs, right? TVs. What do you see? It's like the price dives, right? Cell phones, the price dives. All these things, just like cars, the cost of cars goes down. Like, all of these things are driven lower, and I think that's because of competition. But then you look at the other side of the graph, which actually is showing education, university expenses flying through the roof, right? Healthcare expenses, hospital expenses, I think is what specifically they had on this graph, going through the roof. And what is all of the things that are similar to the things that are going through the roof? There's significant government intervention.
Yeah.
And through, the university systems, we're seeing, people want to say, oh, we should give loans to kids to go to school. Well, what does that do? That gives kids a lot more money to pay colleges. Colleges say, oh, you have a lot more money, we're just going to raise tuition. And so they raise and raise and raise and raise. And ultimately we're at this place now where people are coming out with 200,000, you're a doctor, I'm sure it's way more than this, $200,000 or $250,000. And then they're getting, jobs from their, literature major or something that are making $50,000 a year, and they're like underwater. But that's totally, I believe, because of government intervention into an otherwise should be just like free market, free economic system. And the same thing is going on with healthcare. We mentioned medical loss ratios. I'll give you another one, which is crazy to me. And as a doctor, maybe this will, strike a chord with you. A doctor who's registered or who is licensed in Florida, which sounds like are you in Florida?
Yep.
Yeah. In Florida, can't actually see me in Texas.
I do know that. I've recently found that out. Yeah.
And so it's like, it's crazy to me that you can't see me, which then limits my people, the number of doctors that I can see. And now that we have this virtual health, which is like, I want the best doctor in the world to take care of X, Y, or Z. Well, guess what? You're limited to whoever's in your state. God forbid you're in Rhode Island that has like 10 people in it, right?
Yeah.
Like, you're screwed if you're in those states. Like
Yeah.
another thing that this administration should do is like get rid of these state licensure things. Like if you're licensed out as a doctor, I'm the same human being as Clay. I'm pretty sure that Clay can take care of me just as well as you can and somebody else in Florida.
Right.
Right. I mean, it's the most ridiculous thing and it drives up costs massively. And
Right.
so it's these regulatory interventions that are all for our good, to protect us are actually increasing costs dramatically. And man, if we had more time, I'd be like, we could go on dozens of these examples where the government intervenes in ways that looks good on the outside. As you said, they kind of tie a bow around this that looks great when they're going and raising money for their next political campaign. But in reality, when the rubber hits the road, like it actually drives up cost for, ultimately the consumer, me, or I guess our companies who are paying for this.
No, yeah. I mean, the way that you just described it, all of the checks and balances that are placed on so many different things, especially in medicine, like for us, we go through medical school, rates for tuition are higher than they've ever been. We're getting out with more debt. Not only that, but just to take our exams, like our standardized tests to get through medical school to the next part. I mean, it costs upwards of $2,000 to $4,000 per test. We have to take multiple of them. School doesn't pay for that. We have to do it. And then finally, when we go through residency, there's more checks and balances. We got to take another test, pay the $5,000, finally get our medical license, which is basically a subscription model, right? Like I have to pay $1,000 and then in 5 years, I got to pay another 1,000. And that's just for Florida. So even though I had all of my medical school in another state, I can't practice in that state that I learned all of my knowledge in because I'm currently in Florida, unless I pay another subscription, which is crazy to me.
Well, here's another crazy one. This will be my last one. Again, I get fired up about this, but
I'm here for it.
They have laws in I think it's 36 or 38 states where you can't build a healthcare facility unless you get approval from the state, right? So let's just say that, I'm in a place that definitely needs a new hospital or surgery center or, imaging center or whatever it ends up being, and I think I can build a good business here providing that service. I actually have to get the state to approve that to just build it, right? And they're called con laws. I think it's kind of funny. It's called a con law because it feels like a con. It's certificate of need is why they call it the con law. But unless the state doesn't think that community needs another facility, they will say no. And so what happens here? And in essence, what happens is these big hospital systems in these states, they buy up everything in their local community.
Right.
Nothing else can be built. There's supply restriction to new builds. And so then they can jack up their rates because there's no other alternative. It's almost like an oligopolistic system that's been created because of some of these states thinking it was in the best interest of society that we don't have too many, of these hospitals or whatever. I don't know what the reason is. It doesn't even make sense to me, the reason. I'm not sure how they tied that in a bow, but it's one of these stupid laws that are driving up healthcare costs.
Yeah, and going back to the Affordable Care Act, I saw something the other day talking about when that was passed, there was a clause in it saying that basically if you're a physician, you cannot open up a new hospital or expand on your current hospital that you already have, which is wild to me because if you look at the data, the physician-owned hospitals before the Affordable Care Act had comparable, if not better rates of infection, better patient satisfaction, lower costs. And now if you're a hospital, you can really only be owned by like churches, private equity companies, and then somewhere down the pipeline of health insurance companies.
Exactly. It's absolutely ludicrous.
It is crazy. And I mean, speaking of crazy too, all of this stuff is kind of being brought to light recently. This whole Luigi Mangione thing that happened a while back. I mean, obviously that was a horrible thing and I don't condone any type of that action. And it was, quite frankly, disgusting. But what was wild is that the public reaction wasn't necessarily shock. It was kind of like this weird sort of baseline understanding of the situation. I'm curious, from your perspective, what does that say about how broken the system is and how unheard a lot of people feel?
Yeah, when I saw it, I thought it was tragic. I mean, tragic what went down. I mean, at no point should we be taking other people's lives because we're upset with how the system. If anything,
Right.
you should be talking to your legislature about, why are these stupid rules made up that requires almost United Healthcare to do some of the things that they do. And so I think it's an absolute tragedy that this occurred. I think it does represent we're kind of at a climax right now of people being really, really pissed off that they've had to pay as much as they do for healthcare. That these health insurance plans are, delaying care, requiring pre-authorizations, not pre-authorizing, which I think is another tragedy. I think we're at a climax right now of people just being really, really pissed off at, where our system is in terms of the prices we pay, the pre-authorizations that the doctors have to get that oftentimes are declined, and we can talk about, how that works. The delaying of care. I think Luigi, I didn't read his entire manifesto. I have kind of secondhand knowledge of what he said, but in essence, they kept pushing back care for an event for him and his mom that they were both in significant pain. And so when you're sitting there in significant pain, and a health insurance company now has an incentive to delay your care, I can see why people are so pissed off by this. So I don't understand how you can be so pissed off that you can kill somebody, but I do understand how pissed off people are. And ultimately, my business is being built right now based upon people being really pissed off about healthcare. They think they have, and it's not only think, they know they have this centralized authority that is basically in the practice of medicine, because they're the ones who are saying that, whether or not you can do a procedure. And so, one of the things I talk a lot about is like when you walk into a doctor's office, I'm going to walk in and see Clay, the between me and Clay is my employer, an insurance company, the government, and it's not really between me and Clay. Right. I've said often, it's like you work for whoever pays you, and guess what? The doctor is getting paid by an insurance company, or ultimately an insurance company, and so that's who they have to report to, not me, the end user, because I'm not paying for it. And so one of our things is like our members pay doctor directly. And so the beauty of that is like, it's now between me and the doctor, without any of these other organizations in the middle of all of this. And I think that just yields a much better experience. And I think what we're going to see is way, way better outcomes. And if you're not paying for the product, you are the product. And so people are generally, you are the product of the healthcare system. Yeah. You're not the consumer of the healthcare system. You're the product of the healthcare system, because you have no say really in what gets done to your health, which again is another tragedy of our system.
Yeah. Like you said, there's so many layers to it that it's easy for a bad actor to hide within the layers of how many people and corporations and companies and insurance. And, if you're just paying the doctor, it sounds like it's so much clearer of a picture. Like if you get screwed over, that's the doctor's fault. And we talked earlier about how easy it is to tie things up in a bow. I think it was such an easy one early on, especially after like the opioid crisis, when it was easy to paint doctors in a bad light because that was horrible, that this whole health insurance model and how expensive healthcare was getting was almost really a really easy play to say, doctors are greedy and overpaid, and they're kind of the ones that are leading this charge. And I saw this wild stat the other day that only between 8 and 9% of dollars coming through the healthcare system are actually seen by the physician. Everything else is going 8%. On. God, that's crazy to me.
8%.
Like, the people actually practicing medicine, and obviously I have a biased perspective of this because I am in the medical field, but it's wild that the people actually delivering the healthcare are seeing less than 10% of the money come through. I mean, that can't be a good thing.
Yeah, I mean, we spend $5 trillion on healthcare in this country. That's the latest number I saw. I think it was 4.9, which is, it was a country, I think it'd be the fourth largest GDP. So after the United States, China, and Japan, I think it may have actually just caught up to Japan.
That's nuts.
And so, that's, doctors make on average, I think it's like $350,000 on average. There's 1 million doctors. That's 350 billion, if I'm doing that right. Yeah, 350 billion into 5 trillion.
Yeah.
It's about 7 or 8% if you put benefits on top of it. So that's ultimately where we are right now. And so people look at the doctors and they're like, oh my gosh, you guys make so much money, yada, yada, yada. And you're like, yeah, but I also went through, a decade or more of extra schooling.
Right.
And I've got hundreds of thousands of dollars of medical expenses or medical school expenses to pay. And I go to a residency, which I get paid less than a college graduate with a literature degree. Like, yeah, they should be making more. They should be making more. And if anything, I would say they should be making more than what they're making, because what we're also seeing, especially post-COVID or during COVID and post-COVID, is all these doctors are leaving.
Yeah.
They're leaving all the profession or the parts of medicine that we really need, which is like, I think primary care was in the top 2 or 3 places where docs were just like, I'm done. I'm done with this. It's just like, you go into medicine, I think, and maybe I'm naive, but I think most doctors go into medicine to be like, I really want to care for people.
Right.
And then you get, jacked on rates every year. And, you have to spend 2 out of every 5 days of your week fighting with health insurance plans just to get paid.
Yeah.
No wonder they're leaving. Like, I would leave too. I can't imagine if I had to fight with my employer 2 days of my 5 days of the week just to get paid, as opposed to going in and doing work. And so that's what we're seeing with docs right now. So I would say, like, pay docs more. I think Medicare this year, they're actually decreasing doctors' pay by 3% or something like that.
Yeah, 3.5, something like
3.5. I'm like, what the hell are you guys doing? You need more doctors. Like, and if you want to increase competition, let's get more doctors in as opposed to fewer doctors in, so that we can actually, think about like some kind of market force system here, so that we don't have a limited capacity. I mean, it's absolutely crazy to me what the government is doing in healthcare right now.
Yeah, I mean, if you want a great doctor, you have to get somebody that loves doing it, and you're always going to have those people that go into it no matter what they make. But B, I think also a key part of it is that you have to have somebody that's smart, and I think that smart people are always going to want to take care of their family and take care of themselves. And if they're not able to do that, I had this argument with somebody the other day, well, really just a discussion, but we talk about the sacrifices that you have to make in order to get through the medical system as a physician. And not only are there, 10 years of postgraduate education, you also miss out on a decade of being able to contribute to a Roth IRA and like that compounding interest. And at the same time, and I think this is probably my favorite point, is that all of these people are very high performing individuals. And if they didn't go the medical route, they're going to end up as very type A people in finance and IT and tech. And those have way higher ceilings financially than being a physician. So it's a crazy argument. It's kind of like the same argument as paying police officers less. It's like, okay, yeah, sounds great on the forefront, but if we pay those people less, we're going to get less quality people coming in, because a smart person's not going to do that.
Yeah, 100%. Look, I think that your point is well taken, because look, I pay my regulatory attorney, $1,500 an hour. I mean, it's totally ridiculous. But why do I do that? Because he is like amazing, right? And he can get things done quickly. And then I see these bills come in, and it's for these big procedures, right? It could be a $20,000 or $30,000 procedure, and then I look at what the doctor made, 3 or 4 hours worth of a knee replacement or whatever, and it's $25,000 or $30,000 or whatever. And then you see what the doctor gets paid. It's like $1,000 or something, and you're like, what the hell is going on? That of a $20,000 or $30,000 surgery, the doctor who's actually performing the surgery is getting 3 or 4 or 5% of that. Like, that doesn't make any sense to me. And it just shows you all the bureaucracy that's layered over that doctor, all the administrative BS that's happening. That is kind of the reason why these costs are so high. So it's a total tragedy within healthcare. And we need more folks like you coming out of medical schools and being able to do this stuff, because you're not making a lot of money nowadays.
That's true. I mean, we need more people like you out there, and we need to have a conversation outside of a podcast too, because I feel like this is like a therapy session for both of us, just getting it out, man. So, so look, after all of this, I want to finally talk about your company and CrowdHealth because I had a buddy. I was at my high school reunion the other day, actually, and my friend came over to me and he started talking about your company. He just started doing it,
Oh,
I
wow.
think, 6 months ago, and had all of these amazing things to say. And I talked to him for an hour and still had no idea what the hell he was talking about because I've never heard of anything like this, right? And so, especially after talking to you, at first I was like, this is a great thing for patients. And now I can kind of see the flip side of that to where, oh, it's also a great thing for practitioners. And if we can get more people into this system, then I think the system will slowly start to heal itself. So just from your perspective, just kind of tell people, what is your company and how does it work?
Yeah, in essence, what we are is we're a platform for people to be able to fund large healthcare expenses so that they have the money. They can go and pay the doctor directly at the point of care. And as a result of that, get significantly less, lower prices than what health insurance plans. So in essence, what we're doing is we're enabling people to strip out all that administration and bureaucracy so they can get the absolute best price. And in fact, for bills greater than $2,500, our members are getting about 50% better prices for these procedures than United Healthcare. So you, as an individual, can actually go get a better price for your healthcare services than United Healthcare can get for you. And so all of what we do is to enable people to do that. So I'll give you just a quick example, right? For my daughter's ear tubes, it was $8,000. And so I'll use that example. But like, if I were to go and pay in cash, it probably would have been about $2,000. The way our system works is I would have paid the first 500 of that. Then CrowdHealth goes out and asks 15 people for $100. And if they say yes, that $100 goes from their account to my account. So now I have $1,500 plus my $500. I can pay for these ear tubes directly to the doctor, and I'm getting way, way better prices as a result of that. So you might be like, okay, so why would Clay in Florida give to Andy, who's never met before, for ear tubes for his daughter? Like, that seems, it's like a huge like heart tugger, right? Like, and so, but what happens is when I ask for that money, Clay gets to see the last 10 times I've been asked, have I said yes, 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 or have I said no, 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 no to others in the community? And so if I've said yes, 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 Clay can look at that and be like, man, I like having Andy as a part of the community, right? If I say no, 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 then he's like, dude, this is a dude that's just like wants to take and not give. And so Clay is much more willing to give to me if I've been a good member of the community, which then incentivizes people to be good members of the community. So when we go and ask for those types of situations, 98% of the time people will say yes. And for the person who says no, we'll just ask another person so that I ultimately get my $1,500 plus my $500 to pay for that $2,000 procedure. And so we've done this for 25,000 bills since we've started. 99.9% of those have gotten fully funded. The 0.1% that hasn't gotten funded are the people who are the takers and not the givers. Those have not been fully funded, but everyone else has gotten fully funded. And so the system works really, really well. And then the thing with us, given all the, I kind of talked over and over about perverse incentives, it's a subscription fee for us. So you just pay $55 a month to be a part of this community. And so that's the money that we use to pay our bills. And so we now have an incentive for people to be healthy because they stay with us longer. We have an incentive to love our members well, because if we love our members well, they're going to tell their friends and their family, just like the guy told you at the high school reunion about CrowdHealth. And that's the way that we then grow. That's the way I make more money. That's the way I make more profit, is if we grow. So I'm incentivized to keep prices down. Oh, by the way, if prices go down, the price of my service goes down, which then allows me to go get more people into the community. Again, me making more money. And so our incentives are totally aligned within our system to care for our members well. And I think, and your friend, I think said it great, which is like, it's a great service. It's totally different from health insurance. Like, when you have a really big event, you hear people, they're like, man, now I got to go fight my health insurance company to get this paid.
Yep.
We're fighting with you to get it paid, right? We're on
Wow.
your team, not against you. We're fighting with you.
Wow.
So, yeah, we've done 25,000 bills and it's worked beautifully, and everything from like little virtual pediatric visits to, we had a guy who shot himself on accident. One bullet, 6 holes. That was,
what in the world? Was it ricocheting?
well, I'll say it quick. I know we don't have a lot more time, but like this guy was in Montana fishing, and he was in bear country, wolf country. So he had a 44 in his holster, and he caught a fish, reeled it in, leaned down. The 44 fell out of his holster. It hit perfectly on a rock, went off, went into his calf, out the back of his calf, into his thigh, out the top of his thigh, into his chest, and out the back.
Oh.
So, he was in the middle of Montana. He was 2 hours away from the local hospital. His wife had to take off her shirt and tourniquet his leg, as they thought they hit that artery. What is the artery? You're the doctor. With that big one that goes right through your leg.
Artery. Yeah.
Femoral artery. Thought he hit the femoral artery. She runs up to a hill because she didn't have cell service, calls 911. A helicopter comes in and basically lands in the middle of this stream to pull this guy out. He goes to the hospital. He's in a coma. He goes into sepsis. It's like, I think he was in, ICU for a week or 2 weeks or something like that. It's like nearing $1 million bill.
Wow.
And so then we take that bill, and we actually have a team of negotiators on our side. We negotiated that bill, I think what ended up being like $200,000 or $250,000 as opposed to nearly $1 million. And then we sent that out to our community and got it funded, in a blink of an eye.
And was this guy in particular a previous giver?
He was a previous giver. Yeah.
Wow.
I mean, he had given, I can't even look it up now, but I think he was a 100% giver. Like every time he was asked,
wow,
he gave to somebody else. And so then when it was his turn to ask, in these situations where it's like, you could have never forecasted that. Like that's such a freak accident. And so a lot of people who are uninsured, they're like, oh, I'm healthy. I'm good. I'm, metabolically healthy. All my labs are great. I was like, yeah, dude, but like shit happens. Like you can get into a car accident. I mean, the number of scooter accidents, those little scooters that people roll around town in, like the number of freaking scooter accidents and e-bike accidents that we've had to fund are ridiculous. But it's like our number one cost for the community is pregnancies.
Oh, wow.
The number two is active injuries. So it's people out doing stuff, right, in the world. I'm in Colorado. We're going hiking tomorrow with my kids. Like, it just, things happen, right?
Those are two positive things to pay for, too.
And I was like, dude, I love, let's populate the world. I love, funding pregnancies. I love funding stuff that just happens when, you're out doing life. Like, that's what I want to be funding. Like, I don't want to be funding things because somebody's had a terrible lifestyle for 3 or 4 decades and it's catching up to them. And that's now sucking up 80% of my healthcare. Chronic diseases are sucking up 80% of our healthcare. And the vast majority of those, 80% of that 80%, is definitively lifestyle. Like it could have been, it could have been avoided if you had different lifestyle choices. So we just got a group of people, man. We're at 11,000, almost 12,000 people now who are like, they're fired up about their health. We don't let anybody into the community who's obese. We don't let anybody into the community who smokes. It's like, so you have to be taking care of yourself to be a part of our community. And that's what, fuels our community. We have just a bunch of people who like take care of themselves. We're not paying for all this other crap that, you have to pay for when you're with a health insurance company.
Yeah. I mean, it's like you're part of a tribe. You have to kind of do your part and hold your own in order to be, help the greater good of everybody else. I'm curious, how hard is it to cultivate a community atmosphere with, with HIPAA and all these other things? So like, for instance, if I get in a devastating accident and I go to the hospital and I get my arm amputated and I need, to be covered and I've been a giver, when you put the word out, is it just a nameless person that lives in Florida that needs this help? Like, how does that actually work?
Yeah, we just say we have a member in Florida who had a amputation. Are you willing to help them? Here's, how many times they've given in the past. We actually have one more statistic in there. It's like did they actually get a reasonable price for this, procedure, or did they pay an extravagant amount for it? And in essence, that second part is again to like create some market forces in healthcare that I think again are pretty non-existent. And so we enabled that people to do that too, just to kind of know like, is this person going to the Mayo Clinic for a flu, or
Right.
like are they taking care of things? And that freaks a lot of people out. But all we do is say like, look, before you go get a big procedure, like just call us so we can
Yeah.
tell you what the fair price for the procedure is in
Yeah.
Tampa, Florida, or wherever. And that then people will call us and be like, oh great, do you have any great orthopedic surgeons in Austin or Tampa or Denver or wherever? And then we're like, oh yeah, we've got a list of 10. Our members have gone to these people. These are the ones they love, and they give you a cash price, which is really really good. So you don't have to go into that person. We don't have any networks or anything but this is the one that would be really really good for you to go to. So we provide all that data to our members.
Yeah, let's talk about your database for a little bit, because I did hear about that, about how you have a database of cash pay doctors. Is that true?
That's right.
Okay. So, and I've heard you speak before about how a lot of the times you prefer more private practice physicians over the ones that are kind of under these big hospital entities. Right. So can you explain kind of the importance from your eyes? And if we go over and you need to do something, you just stop me, because I'll just keep rambling too. But I'm good for the next however so long. But yeah, can you kind of go over why you think that way, and why a cash-based business might be a better model for the patient instead of the insurance model?
Yeah. I mean, I have an affinity for, independent docs. They buck the system. The easy thing to do is just let yourself be acquired by this big hospital system. And so I like that open-mindedness, that worldview of doing what's right as opposed to doing what's, the easiest. And so these independent docs typically are going to give you, much better rates because they don't have all the bureaucracy on top. They tend to think more like business people, which I kind of like. So they understand that all of this administration is taking up a big chunk of their costs. And then these independent docs don't have these hospitals who are funneling them business. So these independent docs actually have to go out and create a business themselves, which means they have to have a great product, right? They have to create a great service. And so I personally, and I know this might be controversial, but I think these independent docs generally are better docs than the ones who are stuck in big hospital systems, because they have to go fight for it, and they have to worry about customers coming back to them and things like that. They're like, I gotta love my customers well. I have to pay attention to them, because if they're going to come back to me, then I need to give them a really good experience. Whereas if you're just having a hospital system funnel you patients, you're like, I don't care. The hospital system's going to funnel me patients. So like those are all generalizations. I think I have found through 4.5 years of doing this that these independent docs rock. I mean, they're really really good, and are giving members way better experiences than the hospital related docs. Let me also say though that these docs, other than our customers, maybe these docs love us maybe just as much. What's happening is that these docs are reaching out to us and are saying, hey, I got to build a business. And so do you have people who can come to me? And we're happy to give people to these docs because they are independents. And like I said, for all the previous reasons, they're generally better. And so there was 1 week where I think we had like 50 doctors reach out to us and be like, please, can I go into your database? Because I want people to come to me.
Yeah.
And so as we get now 25,000 data points from all the bills that our members have submitted to us, we're building this database of cash pay doctors who we probably, if you're in a major city and most secondary cities, we probably have a really kick-ass, orthopedic surgeon and ENT and, allergist and, all these, cardiologists, who our members have actually gone to, have had a great experience with, and are willing to give you, cash pay prices if you pay them at a point of care, as opposed to having them go through the rigmarole of billing health insurance. Because these doctors typically, if they're billing health insurance, they have 2 or 3 billers per doctor just to bill health insurance.
Yeah.
Then they got to wait 2 or 3 months to get paid. And then they have to deal with pre-authorizations, which takes up a ton of their time. So these doctors are like, dude, if it's between me and the patient and you're paying me directly, like get me on board because I'd love to do more of that. And then they're less reliant upon the United Healthcares who can come in and just be like, I'm cutting your rate 5% or 10% or whatever this year. So it's not only good for the patient, it's good for the doctors. And over the last decade or so, the pendulum has swung to most of these doctors being employed by hospital systems. I hope we're like a small catalyst in helping that pendulum swing the other way, which is getting more doctors into independent practice.
In a very real way, you are putting the art back into medicine because it's
absolutely
in the doctor's hands, and that's amazing. That's huge. I'm
because right now the doctor has to call the health insurance company and basically say,
ask permission.
Hey, can I do this for my patient? It's like, what the hell? And typically when we went through our daughter's thing, my ENT was fighting with what was it? It was like an optometrist or something, like, or an ophthalmologist or like something that had to do with the eyes. I can't remember exactly what doctor was. But like, what the hell does this doctor know about ears? Right. Yeah. That my doctor has actually looked into her ears and said, she's got a perforated eardrum. Like it needs to be fixed. And he actually took a day off, or he left a day late for his vacation to do my daughter's ears because he was so worried about long-term hearing loss.
Oh, wow.
So, it was that bad. And so maybe that makes us bad parents with not bringing her in early enough, but whatever. And so it's like these health insurance plans can just say no, and there's no recourse for me as a patient. Like there's nothing I can do. Like I can call the attorney general's office in the state of Texas, but like, that's not going to do crap, right? No. Like they're not going to do anything about it.
No, I agree.
Whereas, by the way, if CrowdHealth does that, what are people going to do? They're going to go on Twitter. They're going to say CrowdHealth sucks, right? And they're going to say all these things, which totally destroys my business.
Yeah.
And so we have every incentive in the world to like get these bills paid.
Yeah, and United Healthcare is going to be retweeting that for sure. Yeah, exactly. They're going to be trying to take you out. That's amazing, man. I'm curious, where does this integrative, functional, regenerative, whatever you want to call it, this kind of new age preventative medicine, where does that come into play with CrowdHealth?
Yeah, I mean, I think, look, we talked about it earlier. I think that you go into kind of the typical allopathic system and you got 10 minutes and they're going to feed you pharma.
Yeah.
And I don't think that's the right thing for our members. I don't think it's right for the system. I don't think it's, ultimately what I've said to my team, and I've said this publicly too, it's like, yes, I want to make money. I want to save our customers money, but ultimately I want our members to be 80 years old playing wiffle ball in the backyard with their grandkids. Yeah. Right. And I think that we've got to get to the core issues. And so that's why we think that the integrative kind of approach to this is a much more interesting way of going about it. And so if our members want to go to integrative docs, then we're like, great. We love that. If you think that, acupuncture is going to solve your, whatever issue, and you want to try it, go for it. If you think a chiropractor is going to solve your issue, go for it. Just a quick story. I have back issues where like once every 6 months, and you're a doctor, you probably know what this better than that, but like my rib cage disconnects from my vertebrae. So apparently there's like a little nozzle or something and my doctor was like, oh yeah, we can fix that with surgery. And I'm like, dude, it happens every 6 months. Like, I don't want to be out for 3 months just to get this fixed. He's like, yeah, man, I get it. I go to a chiropractor once every 6 months or so, and he gets it back in order, and I'm good for 6 months. And it sucks that I have to go and do that. But like, would I prefer to do that as opposed to getting surgery, which these back surgeries, like you never know what's going to go on with these back surgeries, right? I'm going to be gone for, 3 months, and, just laying on my bed probably because of this back surgery. And it's going to cost $40,000 or $50,000. Like that's the decision that I think our members should make. That I think most of the time people don't want to go and do the surgery. They want to figure out some other way of like getting care as opposed to going under this like very invasive, sketchy outcome type of surgery. So we're all about people going in and doing those types of things for their injuries or their illnesses.
Yeah. I mean, plus I think that's kind of on us as physicians too. We have a a field that sometimes has a deficiency in humility. So we don't want to admit that maybe another specialty knows a little bit more about something than we do or could fix a problem easier. And I think over time we've demonized practices like chiropractics and acupuncture and some things that have been around for thousands of years and have worked for millions of people. And we love to demonize people like that, just like pharmaceutical industries love to demonize compounding pharmacists. I mean, you see it everywhere.
Yeah,
And
exactly.
and so, yeah, I mean, I love that. I love that your company is, I'm a Christian, and I just love that your company is kind of the embodiment of love your neighbor or treat your neighbor like you want to be treated, right?
Amen.
That's
Amen.
crazy.
Back to generosity. One more quick thing, and maybe this is a tangent on your question about kind of integrative or alternative health.
Yeah.
I think one of the things that we don't do well, or they don't do well in the allopathic system, is again focusing on like what are the root things that I should be thinking about in terms of my health. And I think metabolic health is such like a key component of this.
Yeah.
And so one of the other things that we do is we actually will fund like a DEXA scan so that people can see their visceral fat.
Nice. That's amazing.
And so we educate people on like, okay, so why is visceral, fat really important? What does it mean to be skinny fat? And those types of things where like that's a pretty good proxy of your metabolic health. We did gut health last month so that you could go and take a test, wipe your butt, basically go put it in, and it'll give you kind of an overall view of your gut health. I think gut health is important. That's something that allopathic kind of medicines thinks is total crockery. We're doing in Q3, we're doing coronary artery calcium scores, which, is a very low cost, non-invasive imaging where you can get it for like $100 and it'll tell you like, are you getting plaque buildup in your arteries? And I think, again, we want to give people that access to that information so they can make the lifestyle choices. Whatever the saying is, like whatever you measure is what's going to improve, right?
Yeah.
Like you can start like looking at those things, and then I think we're doing like fasting insulin in Q4. So these like metabolic health centric things that we think if we can control in our 20s, 30s, and 40s, we can live a lot better lives in our 50s, 60s, 70s, 80s, and 90s, right? And so, and none of those, from what I understand, are eligible for crowd or health insurance. They are eligible with CrowdHealth. They're not eligible with health insurance. And to me, that's absolute stupidity. But it goes back to, I don't have an incentive to keep you healthy. One, because costs are going to go up and I make more money. And two, it's like, you're just going to bounce to the next insurance plan next year. So I don't really care if you're healthy in a year or 2 years or 10 years or 20 years. And so we just take a totally different approach on that.
That is amazing. I mean, that's my favorite thing that you've said all day. And there's been a lot of things that I've liked that you said, but just doing that sort of kind of setting the precedent for your clients or patients or whatever you call them to go and do those things that makes them think about their health earlier, so that when they get to that stage where maybe they're in their 70s and 80s, they've already thought about this 30 years ahead of time, and they're not getting there like, oh crap, I can't do any of the things that I thought that I was going to be able to do when I was retired. Like, for instance, me, I'm in the healthcare world, and I wanted to go get a DEXA scan because I wanted a baseline. Like, I know that my bone mineral density probably peaked at around 22, and I wanted a baseline so that I can keep track of my bone density and my skeletal muscle mass as I age. I work at a hospital. I could not get it done. My primary care doctor wouldn't order it. I had to go to a bodybuilding gym in town and pay them $200 cash, and I got my DEXA scan. So it's crazy, man. I mean, it is wild that you can't make the case for some of these things when the data is just blatantly clear.
Well, we've gone one step further with this, which is if you've got a great visceral fat level or you've got great fasting insulin, you can actually get up to a 20% discount on CrowdHealth as a result of that. Right. So I think it's crazy within health insurance. Like it is illegal for health insurance companies to price your service based upon your health. And so, it's why it's so crazy is like, car insurance, like they have these things now, they can plug them into your car and see how good of a driver you are, and it'll give you different rates. If you get in an accident last year, like they can bump your rate this year. And so,
Or if you're
we
driving
can't
a
do that.
Lamborghini versus a
Exactly.
Toyota Celica or whatever. Yeah.
Exactly. And so, yeah, we're giving up to a 20% discount on your crowdfunding component of our
Wow.
service if you are under 5 in fasting insulin, and then the bottom 25, basically the bottom quartile in terms of visceral fat.
That's awesome. I mean, you basically gamify your own health, which is awesome.
Exactly.
That's
Exactly.
that's amazing. So, where do you see healthcare going in 5 to 10 years? Do you see it going anywhere in that short of amount of time? I know you obviously have a vision, but realistic speaking, do you see any big changes being made?
Yeah, I have zero hopes for our existing system. I mean, I think we can maybe be iterative, but it feels like every time the government tries to be iterative, it actually gets worse. Like they try to,
Yeah.
there's all these unintended consequences that they don't really fully understand. And so ultimately, look, I think I would really like people to start paying more out of their own pockets for these services. That's going to drive prices down. It's going to get more independent docs into the system. It's going to keep the independent docs that are in the system from going into, the hospital systems. And I think we can be a way of doing that. So, I think there's 100 million Americans or more that are, eligible for CrowdHealth that we'd love to have you on board. So yeah, we've got 11 or 12,000 members now. We think we'll have 100,000 members in the next 2 years. We hope to have 1 million within 5 years after that. Look, maybe the Lord's got a different vision for us. Maybe we go to 0, or maybe we go to 5 million. I mean, that would be amazing if we did that. But if we could show a viable alternative to the way that we've been conditioned since we were young to think we have to have health insurance, that's my biggest barrier is people are like, oh my gosh, like what? I'm uninsured. I was like, no, that's great. We are delightfully uninsured. I actually have a t-shirt. I should have wore it today that just says uninsured on the front of it.
Wow.
Because I think this is a badge of honor as opposed to being a lemming in a system that is taking advantage of you.
I mean, back in the day, even now, if you tell somebody that you're uninsured, they look at you like you're a walking orange traffic cone.
Yeah.
Yeah, man, that's amazing. So if people are interested that watch this, if they're interested about learning more about CrowdHealth or joining, what is the best way for them to do that?
Yeah, joincrowdhealth.com is our website. It takes like 5 minutes to sign up. You can sign up whenever you want. You can leave whenever you want. So there's no like annual contracts or anything like that. If you want to go check it out on any of our social media platforms, Join CrowdHealth is on all of our social media platforms. We're doing a fun thing right now on our social media. I don't know if have you seen some of those Yeti and Bigfoot videos that are popping up on
those
Instagram?
I saw you guys post one of those too, I think.
Yeah, we episode 2 is coming out tomorrow. So we're doing an episode where Yeti and Bigfoot get into a big accident and then have to navigate like the healthcare system. And so I think it poignantly kind of points out like all of the craziness that happens in healthcare that people don't understand. And we're walking Yeti and Bigfoot through those things. So we try to have fun. We try to be a little bit silly. We're not your typical like, buttoned up ties and suits types of insurance company. So I think people will enjoy it. So go to Join CrowdHealth on any of the major social media platforms.
God, I wish with the HIPAA laws and everything that you guys could do some sort of social with everybody that's in CrowdHealth, like some music festival or something where you get everybody together, because that would be amazing.
Do it. We actually do it.
You?
We were in Vegas 3-4 weeks ago.
Wow.
And we invited anybody who wanted to come out. We went to Fogo de Chao,
no way.
Like meat eating, establishment. We had 100 of our members show up and actually have dinner with us, and we got to interact with them. And the guy who shot himself was there. He's like my hero. I got a picture.
Oh my God.
So we got to meet our members. They got to meet us, and it was really, really cool. So we do that once a year. We might extend that to twice a year.
Oh, that's amazing. I want to be a part of that at some point. That sounds fun.
The next one actually might be in Tampa in November. So if it is,
what?
I think we might do one at Hack Your Health in Tampa in November.
I'll be there.
So if we end up getting that together, I'll let you know. You can come by.
100%. Yeah, I'll be at that conference too. So if you end up making it down here, let me know.
Yeah, I'll definitely be there.
Andy, thank you so much for this. It's been awesome, and it was just unbelievable to talk to you about everything that you're a part of, and you obviously have a whole base of knowledge about this whole subject that I am not exposed to in the medical community. So it's great to get your perspective on everything, and 100% want to do this at some point in the future again.
We'd love to have you. Yeah, we hope that the pod flourishes, and congrats on getting it going. I'm honored to be one of the first few that on your pod, so I'm excited to see how it goes.
Well, I'm honored to have you, man. All right, we'll talk soon. Okay.
Thanks for having me.
See you, man.